Good evening. I am going to spend a little bit of time going over the emergency order that was placed in Barry-Eaton County by our health department. I'm going to spend some time on several of the points. There's 10 total on here. I'm going to spend time in just a few of them to explain how she came to this and how she used very misleading data to come to this conclusion. So first, I'm going to read number two. The Delta variant SARS-CoV-2 virus is the current dominant variant in Michigan and is significantly more contagious than the original form that entered the United States in the winter of 2020. Current research indicates the Delta variant may cause more serious illness in persons of all ages, including children. The interesting thing here is that she talks about may cause, which also means that it may not cause. And one of the things that you'll notice when what I've noticed from the health department, from Colette specifically, is when she is presenting data, when she doesn't have data that backs the conclusion she wants, she makes a statement. When she has data that she believes makes her point, she grossly misrepresents it. So here she's talking about a study. She's talking about a study that the Delta variant may cause more serious illness, but doesn't give a source and gives no data to back it up. In number three, COVID-19 infections and COVID-19 hospitalizations are increasing among children in the United States, with over 200,000 children testing positive in the week of August 19th through 26th, according to a report from the AAP. This is an increase from 2 weeks prior, when just over 120,000 child COVID-19 cases were reported. Local data aligns. Barry-Eaton District has a 219% increase in new cases when comparing 2 week period of August 1st to the 14th and a 2 week period from the 29th to the 11th. So there's a lot in there that is extremely misleading. And one of the things that you will notice, not only in this, but also in the presentation that was given to the health board in the middle of August, is that when she wants to make a point, she uses large national numbers. When she wants to talk about local, she talks about percents, and then she merges them together. So when you're reading this, you're seeing 200,000 children, and you're seeing a 219% increase. Both of those sound radical, right? Um, and the other part of this that I find interesting is she talks about August 1st through the 14th. Then she skips a 2 week period, and then she goes August 29th to September 11th. Because my guess is that the data in between there probably does not um, make her case, or she believes it doesn't make her case, or certainly doesn't show a 219% increase. Now, here's the interesting thing. When you're talking about a 219% increase, I got this information from the Barry-Eaton Health Department. So this was published today, and it talks about 78 students and 9 staff were infectious on school grounds. So let's focus on the 78 students because according to this emergency order, this is putting masks on our children is to save them. So 78 students in a 10-day period. So 78 students in a 10-day period. Here's where it gets interesting. In Barry-Eaton County, there are 68 public schools between the two. Those 68 public schools have about 25,000 students. So 78 students in 68 schools over a 10-day period is just over 1 or 1.15 students per school in a 10-day period. So 78 students in a 10-day period, 68 public schools in Barry County. This is only the public schools. If you add in the private schools, it's actually less than 1.15 students. But I wanted to use public schools because I'm not 100% sure if the private schools report to this. So I wanted to try to stay as consistent as I can. But again, 1.15 students per school in a 10-day period is an emergency. I want you to wrap your head around that. 1.15 kids every 10 days on average in our schools between Barry and Eaton County, and that is now an emergency, and we must mask all of our children. Back to the 25,000 students. So over this 10-day period, 99.7% of the students had no diagnosis of COVID. So we're masking 100% of our students because we're getting, on average, just over one student every 10 days testing positive between Barry and Eaton County. So number 4, the health system capacity has become strained with high community transmission compared to July. There was a 467% increase in Barry County and 220% increase in Eaton County hospitalizations for COVID-19 and related complications. So again, here we are with these large percents. So it's very important for us to say, okay, what does that 467% represent? And what does that 220% increase represent? Well, good thing that we have this great website on michigan.gov that tells us how many actual patients are in the hospitals in Barry and Eaton County. So for Eaton County, I believe it is, pardon me while I find it, I'll probably find, so Spectrum Pennock, which will be right there at the top. So that's the hospital in Barry County. The 467% increase that she spoke of is now 6 people in the hospital compared to July when there was 1. So 1 to 6 is a 467% increase. Why would she put 467% increase and not just simply state that there are currently 6 hospitalized in Barry County? My guess is because it does not fit her agenda here. It does not. 6 hospitalizations in Pennock Hospital, a hospital that has 60% bed occupancy, is not an emergency. So she has to present it in a different way, and that's where she uses those large percentages. Here's Sparrow-Eaton. Sparrow-Eaton has 7. So that 220% increase amounts to 7 current hospitalizations at Sparrow-Eaton. And that goes, the 220% increase would be 2 in July, 7 now currently currently as of today. So again, you have to ask yourself, why would she misrepresent this data, not giving numbers like she does when she says 200,000 students, when she's using national numbers? Again, that's the way she misrepresents these facts, by using numbers that provoke fear and emotion. So number 5, although vaccines prevent most infections, reduce community transmission, and reduce the risk of severe outcomes due to COVID-19 disease, COVID-19 remains a public health issue that impacts local institutions, particularly in education settings where students younger than 12 are ineligible to receive the vaccine at this time, are required to receive an education and attend school 5 days a week. So here we are talking about severe outcomes again. So here's some interesting information when it comes to severe outcomes. So if you watched the previous presentation that I did when I spoke about severe outcomes, this is basically the same information looked at a bit differently. So here is this part of the pie here is 80 plus. So of all the COVID deaths in the state of Michigan, 42.62% of those COVID deaths were people 80 and older. 70 to 79 is almost 27%, and 60 to 69 is almost 18%. So basically, everybody age 60 and older represents 87% of all the deaths for COVID. So if we're trying to fight severe outcomes, clearly the population that is at most risk are those 60 and older. If you try to find out the the percentage of death in um, school age children, the number's so small on this graph that you basically can't get it. But I can tell you that it is 0.08% of all deaths are from the ages of 0 to 19. So again, this health order is to try to prevent severe outcomes in children that are going to school, K through 12. So we're seeing here that not only are the severe outcomes really, really low, the amount of deaths in Michigan are less than 20 for those 0 to 19. But school age children have a greater than 99.99% survival rate when it comes to COVID-19. So to recap, highest rate of death for 60 and older at 87%. Those are the severe outcomes that we need to protect against. Now, the great news is, according to the Barry-Eaton County website, the vaccination rate for those 75 and older in both Barry County and Eaton County is 100%. Those 65 to 74 in Barry County is 88%, and 65 to 74 in Eaton County is now 92.7%. So, if we are truly trying to reduce the risk of severe outcomes, like number 5 says, we are already doing that by her own definition that vaccination prevents most infections and reduces the transmission. So if the highest risk population is vaccinated at a greater than 90%, we are already protecting against severe outcomes. Our children do not need to be masked based on just this information alone. So number 6, studies of COVID-19 incidents in school districts during the 2021 school year demonstrate that proper masking is the most effective mitigation. This is another instance where she mentions that it masks work, but there's really no data behind it. She's not pointing to anything like she is in any of the other points where she's trying to make a point. She's just making a declaration because it's been said over and over again, and she's just going to keep repeating that masks work. So number 7, masks are primarily intended to reduce emission of virus-laden droplets, which is especially relevant for asymptomatic and pre-symptomatic infected wearers who feel well but may be unaware of how infectious they are to others, who are estimated to account for 50% of all transmission. Masks also help reduce inhalation of these droplets. The community benefit of masking SARS is to control the combination of these effects. So then it goes on to say, benefits increase with increasing numbers of people wearing masks consistently and correctly. So it's consistently and correctly. We all know, we've all watched people with their masks. We know that we do not wear masks properly. Most adults don't wear masks properly, and certainly most children do not wear masks properly. So what I wanted to do was see exactly what does the CDC say about wearing masks properly. So interestingly enough, it tells you what kind of mask to choose, okay? It says that these face shields aren't needed. Make sure children have a mask that fit them. Use a mask fitter or a brace if you've got a beard. And then it goes on and on and on how not to wear a mask, right? Then it says, it goes through this how to take off your mask. So here's where we know most adults and all children fail at the masking part of this, right? There's no way that we can watch children uh, carefully untie, handle the loops, fold the outside over the corners. We know this doesn't happen. I've watched my own children do it. Heck, I've done it. I've taken it off, scrunched it up, put it in my pocket when we used to have to wear masks to get into stores. So we know that this isn't. So the moment we stop wearing masks effectively, we are we are basically eliminating the use of the mask completely and really putting ourselves in danger. Then it talks about how to wash it, how to store it. I can't imagine there's anybody on the planet that is taking their wet or dirty mask, putting it in a plastic bag, and they're not storing their masks in a paper bag. I've yet to see that. If there are people out there doing that, that's great. But I have yet to see it. So back to her definition of how masks work, and they have to be not only consistently and correctly. So clearly, this masking our children will not work because they cannot wear them correctly. So now we're on to number 8. On August 18th, 2021, she talks about the presentation that she gave to the uh, board. And it talks about counties with mask mandates have experienced lower rates of illness. So I went and looked for that information. And what I did was, pardon me, went to the Kent ISD website and pulled down, and the Delton Kellogg website, and I pulled down the year-to-date COVID students and their enrollment. So in the enrollment, I just basically rounded to the nearest hundred just for the sake of making it simple. So we have Byron Center, 32 COVID positive students, Cedar Springs 85, Caledonia 57, Forest Hills 48, Kentwood 57, Thornapple Kellogg 24, and Delton Kellogg 6. So the two unmasked in this list are have the fewest COVID cases. So then I said, okay, let's try to balance it for enrollment and use a cases per 100K, which we've seen the CDC use multiple times in trying to compare transmission levels in various states. So here we are with Byron Center at 800, Cedar Springs at 2,400, Caledonia at 1,140, Forest Hills at 505, Kentwood at 655, Thornapple Kellogg at 686, and Delton Kellogg at 500. So the reason why I show that information is because it proves that number 8 is it's just a non-truth. It is a misrepresentation of the facts because the counties with mask mandates have not experienced lower rates of illness. Not in those schools, and not in the Kent ISD schools that we pulled down and added Delton Kellogg. So now we're on to number 9. Most students do best with in-person learning, which was compromised in 2021. They need to isolate and or quarantine students and remove them from in-person learning environment is significantly reduced with with the use of face masks in school. Last year, there were 1,146 instances of quarantines at Thornapple Kellogg alone. We got that information via FOIA. I don't have the information for any other Barry County school or Eaton County school, but I do have it for Thornapple Kellogg. So there were 1,146 individual 10-day quarantines that occurred, and we were masked. So that is a lot of lost learning days. That was one third. It's basically one third of the school at any given point was quarantined over the course of the year. So this makes number 9 in a ludicrous statement that we have to do these things in order to protect in-person learning when the quarantines did the exact opposite. All those lost learning days for what amounted to less than a handful of actual kids coming down with COVID during their 10-day quarantine. So the wearing of face masks in schools is supported by Barry-Eaton, Eaton Rapids Medical Center, and Spectrum Penna. These local healthcare institutions continue to see severe impacts of COVID-19 on all our communities, including young people. Use of face coverings in school settings helps preserve pediatric hospital capacity. So earlier I showed you that there are currently um, six people with COVID at the Pennock Hospital in Barry County, and there are 7 at Barry-Eaton. So clearly, they are not inundated with COVID hospitalizations. But she mentioned that it includes young people. So I went back to this great website that tells us uh, who is in the hospital and where are they. So I'm going to focus on both Region 1 and Region 5. Region 1 is the region that Eaton is a part of, Eaton and many other counties. And Region 5 is where Barry is, and it's Barry and several other counties. So we have, if you go down 1, 2, 3, 4, 5, I'm sorry, go down 3, you can see Region 1. We'll actually go down 4, I apologize, to get the hospitalized pediatric confirmed. So in Region 1, there are 0 pediatric confirmed hospitalizations in all of Region 1, which includes Eaton County. And in Region 5, there is 1 hospitalization of pediatric in all of Region 1 or all of Region 5. We don't know if that's Barry County because there are, like I said, several counties in there, but hardly the statement of number 10 where the hospitals are telling us that they're being severely impacted by COVID, and it's including young people, because it's just not true. So the other highlight I have here is number 1, where it talks about, again, properly wearing a facial covering. And I won't go back to that site to show you the CDC site, but I wanted to kind of call that out at the end of this. So just to kind of recap, when you see something from the Barry-Eaton Health Department and it talks about United States numbers in large quantity and backs it up with a percentage in the county, always try to dig to find out where those numbers are, because they're almost always misleading. As a matter of fact, I haven't found a case yet where they weren't misleading. So I hope this information was worthwhile, and I look forward to uh, seeing as many people as we can tomorrow at the Barry-Eaton Health Department meeting so that we can talk to the health board and let them know how we feel about these draconian mask mandates in Barry-Eaton County. Have a good night.